Once a stroke occurs and the immediate care has been given, what happens next? What's involved for your loved one and for you and your family? Dr. Patrick Schmitz here to walk us through the road to recovery. Dr. Schmitz, the medical director of the Cleveland Clinic Rehabilitation Hospital at Euclid Hospital. Thanks for joining us again, Doctor.
You're welcome.
We had you on a few weeks ago. You talked about what stroke is and the importance of timing, getting something done quickly. But once that's done, once our loved one's in the hospital, what's the next step?
Okay, that's also a very important question. There's some confusion revolving around that. I think if you're a family of a loved one who's had a stroke, there are a couple of key things that you should ask. One is, are you going to a inpatient rehab hospital that provides a team approach? And that would include folks like myself that are board certified in physical medicine and rehab or in stroke rehab, a neurologist, for example.
There's a specialty in stroke rehab.
Well, there's a specialty in physical medicine and rehabilitation, and within that specialty, as well as within the specialty of neurology, there are stroke specialists.
Gotcha.
Some of those folks practice in rehab hospitals like myself.
Gotcha.
The Cleveland Clinic, for example, has 3 of those hospitals: Lakewood, Main Hospital, and Euclid. Euclid's the biggest one, and we've done stroke rehab there for 40 years. So in any event, the important things to ask: do you have the right medical personnel there? Do you have stroke specialists? Is there physician care 24 hours a day? So, you know, Euclid Rehab, for example, is attached to the main hospital, so we have physician care there, you know, 24 hours a day. The other important issues are the team. Who's on that team? Physical therapy, speech therapy, occupational therapy, recreational therapy, art therapy, music therapy, the physician,
I'm getting
social
tired
worker,
just listening to all these different kinds of therapy.
Psychologist, also very important. Not only for the patient, but for the family. You know, we often bring the families in and they go through the program in some sense as well.
Sounds like a huge commitment for the patient, things that they have to do, and also for the family.
It is. It is a big commitment. You know, it's a big event when someone has a significant stroke. So we often need the families there. We ask them to come in and go to therapy.
Really?
We want them to see what's going on. We want them to know how things are going and what the picture's going to look like when their loved one goes home.
You had mentioned this team approach, and it sounds wonderful to have all these different specialists that can help work with someone. Tell us more about, you know, what each member of the team does.
Okay, sure. Well, there's the rehab doc, the rehab specialist. The psychologist often helps with the patients with depression. Depression's very common after stroke, and also with the family adjustment. We have speech therapy that works with swallowing and language, cognition, memory issues. We have physical therapy that works with your ability to get up, move around safely. Occupational therapy works with the things you do every day, getting dressed, doing things you need to do in the bathroom, all those important things that no one thinks about.
Do these team members work together?
They do. They work together, and sort of the interesting thing about an inpatient rehab unit is that each team member has an equal voice. So when we have a meeting, you know, each person around that table has a definite voice into what's happening with that patient's care.
You actually get all these folks together in one room?
We do, twice a week.
Twice a week?
We see each other every day, but we get together in a formal fashion twice per week.
Wow. And tell us about the results. How does this end up?
Well, if you think about it, one word to me, or one phrase, would be getting the person home, back to the community.
That's the goal.
The inpatient stroke rehab hospitals do a good job with that. About 75% of their patients, they're able to get back to the community, back home. So that's
And you mentioned Cleveland Clinic, Maine.
Right. Lakewood and Euclid.
And Euclid's the biggest.
It is.
All right. Thank you very much,
You're welcome.
Doctor.
You're welcome.
Rehabilitation from a stroke takes hard work from the patient, the family, and a team, a medical team. But as Dr. Schmidt points out, the hard work pays off. My thanks to Dr. Schmidt for joining us today.
To find out more, contact the Cleveland Clinic Rehabilitation Hospital at Euclid Hospital, 216-692-8668, or www.clevelandclinic.org. Next, Pass the Nuts.